Hi, good evening, and I thank the National Board of Examinations for this opportunity to present the functional AI pyramid model and the AI maturity model. It is very important for us to understand that if we have to govern the clinical teams and govern AI, not only that we need to understand the larger picture, the grand vision, but we also need to understand the granularity of AI. We have to be clear on the scope and scale of AI integration through its functionality into clinical practice. And also, let me put a few riders before I start my talk. One is that none of us would be doing the things that we do today in the next 3 years. So, effectively, what I mean to convey to you is that it is not that AI will hit us in a decade or impact us in a decade, it will impact us in this decade. That means this shrinks our timeline for change to just around 3 years. Also, another topic that I am very focused to share with you that AI is a trending topic. So obviously, we need to be taking care of understanding it. But I would always insist to clinicians and other healthcare providers that let's not get drowned by this overwhelming focus on AI, but understand the larger context, the context of digital health. AI is a subset of that. And I'll dwell on that going forward. So, the disclaimer this lecture is a shorter form of a larger lecture at the Academy of Digital Health Sciences, where we train senior clinicians and healthcare providers. And the functional AI pyramid, the AI maturity model framework, is the original work and is copyrighted. So, if you are using it in parts or whole, just make sure that you properly attribute it. To know whom you are talking to, I have been in this field for little over 3 decades. I had a chance to work with almost all the multilateral bodies, being invited by them. I served on the Global Agenda Council for Digital Health at the World Economic Forum way back in 2012. I was also a part of the team that wrote the first digital health guideline of the World Health Organization. And I was invited by the Prime Minister's Office of Bangladesh to draft their AI policy. And I was given the Global Impact Award by the HIMSS organization, Personal Connected Health Alliance, in Boston in 2018. I chair the Commonwealth AI Consortium for Capacity Building. And also, I have been the chairman of the Dynamic Coalition on Digital Health at the Internet Governance Forum, which is a specialized body of the United Nations. I served as advisor to the Union Health Minister between 2016 and 18 when massive transformations took place, including launching the biggest health scheme in the world, the National Digital Health Mission. And I played the key role in drafting the National Health Policy and the National Education Policy of India. Last month, I was appointed by the Secretary General of United Nations on the multi-stakeholder advisory group of the Internet Governance Forum, which is, as I said, the specialized arm of United Nations to look at the digital technologies and internet. When it comes to corporate governance, almost 2 decades ago, I went to Kellogg School of Management to understand the corporate governance. And now I apply that to AI and other technologies. I've authored 5 books, and 2 of them have been in healthcare. I've written multiple reports, uh, various reports of the World Health Organization. And also, I was among the 13 people who founded the Global Digital Health Index, which has become the Global Digital Health Monitor, adopted by the World Health Organization. In the last decade, I founded the Academy of Digital Health Sciences and Health Parliament way ahead of time, much before COVID. It was clear to me that the world is changing and digital health would be integral to healthcare. So we launched this with global leaders from Estonia, Canada, India, to make sure that we upskill every single clinician, not just in India, but abroad. I also believe that not knowing digital health is a major digital disability and it should be addressed with high priority. This is my favorite slide. It's a 12-second video by Tim Cook, the CEO of Apple. Share this out.
If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health.
So if you heard this video where it says that the biggest contribution of Apple to mankind would be about health, the message is absolutely clear. If all big techs are getting into health, and if all healthcare professionals don't get into technology, we'll be ceding our ground to those big tech. This is the last thing that we can afford, is to give up our competence to big tech. So I insist that all of us should understand and implement technology. This is a very interesting law called the Moore's Law, more than 6 decades old. It's never taught to us in education, sadly. It was about computing power doubling every 24 months then. The next one, again, is a favorite of mine, the Buckminster-Fuller's knowledge doubling curve. Again, 4 decades old, never taught to us. If you look at this, that the knowledge doubled 500 years, every 500 years in 15th century, down to 12 hours in 2020. This is pre-AI age. So I guess in today's time, we're doubling information every few hours. So just understand that the degrees that we all have earned years ago, decades ago, how relevant they are in today's context. My next slide will tell you the speed of change that all of us are living in. Look at the model release timelines, and you will see from this that from OpenAI, the average gap is less than 2 months. Anthropic, less than 2 months. Google is almost 3 months. So newer models of technology or intelligence are coming in less than 2 months. So those of us who did our degrees few decades ago, have to go back and reskill ourselves on what is driving the field we are in. So it's not an option. And I'm so happy and thankful to the National Board of Examinations to have started this series on AI. And this, I understand, is the last lecture. How important it is, we will get to know as we progress ahead. This is another interesting slide that by 2023, artificial intelligence left behind the human expert level. And I'm sure in the last 3 years, AI has come a long way. It's another call to action for every clinician, every healthcare professional. This is a very important message. AI is not a standalone technology. It's a collaborative technology. And those who will focus on AI will learn just a tool. And those who will master digital health will understand how to fully leverage AI working with other tools and technologies. So I'm going to cover healthcare building blocks so that you understand the context. Because when I see people say digital health and artificial intelligence or digital health and telemedicine, I sometimes feel sad at those who do not understand the context of what is digital health. So let me give you a clarity about the digital health building blocks. Healthcare information technology, cloud, digital health records, patient portals, hospital management information system, and other software solutions, wearables, Internet of Things, medical devices, point of care diagnostics, data analytics, AI and machine learning, which includes generative, multimodal AI, blockchain, chatbots, large language models, large action models, genomics, nanomedicine, predictive precision, personalized and quantum computing, ethics, privacy and security, augmented reality, virtual reality, mixed reality, metaverse, gaming, robotics, drones, and 3D printing, mobile health, digital consultations, consumer digital therapeutics, and prescription digital therapeutics. All these are building blocks of digital health. So I hope with this stage where we have reached in the lecture, you got one clarity. If you write digital health, never suffix or prefix it with AI. AI is a subset of digital. All these are included in it. Again, digital health building blocks are a subset of the digital health ecosystem. Unfortunately, in the interest of time, I am not going to touch on the digital health ecosystem. In our full course on digital health, um, we have this covered along with building blocks. This is more important for you if you're going to build solutions, if you're going to work in this field, you need to understand the building blocks and the ecosystem both. Now, these three words, digitalization, and digital transformation. I deliberately put the building blocks and these in this lecture to make you understand, as I said, the scale and scope of digital health. I give lectures and I teach digital health in Germany and give lectures across the world. And I ask this question every time. If someone can give me a difference between these three words, very rare for people to stand up and answer unless they have been a part of one of our courses in digital health. But let me get this to you clarity in next slide. In a short form, to me, digitization is conversion from analog to digital. Digitalization is adaptation, the changing of the processes, and digital transformation is creation. Now, what it means in context of healthcare, let me give you the example. If you take a patient's record and you scan it, you have digitized the information. It is just uh, taking from analog, physical to digital form. The next is digitalization, automating processes, streamlined processes, which is essentially electronic health record. That's digitalization. You can run analytics on that. And when you take to the next level of creating a digital consultation or a tool that captures the first two levels, that is digital transformation. So you created something, the digital consultation. So digitization plus digitalization will equal to digital transformation. So you get clarity on these three. So now I should move to my topic, the functional AI pyramid, the AI maturity model frame. This is original piece of work and the terminology I've assigned to each levels. There are actually 7 levels of AI, but I'm only sticking to 5 levels of AI in this lecture. There is a 25-page paper on this topic that you're going to hear from me today, and you can download that from the Health Parliament app that's available on Android and iOS. The paper is available for free along with multiple other reports that could be helpful to you. So why did I make AI into 7 levels or five levels for this pyramid sake? If you want to implement AI, whether as a clinician or whether as a person running a healthcare organization, you have to understand how AI progressively integrates into your practice in your organization. Unless you know that pathway, you will not succeed. You will end up doing some blunder. But then there was nothing available in this understanding which a non-technical person could understand. And AI has been around for a fairly long time since its uh, ideation in the late 50s. So the first level is conversational AI, AI that talks. I gave it the name of talker. So let me give you a analogy that you will understand or an example. So if you buy something online today, and if you have to complain or get in touch with the supplier, you actually talk to a chatbot. Now that's conversational AI. That's an AI that talks. The timeline is it started in 2015, has reached scale in 2024. Um, in the decade around 2007 or so, I joined the Mayo Clinic platform and Neuber Foundation joint venture as a medical advisor and served there for 8.5 years. So Mayo Clinic started implementing this around 2015 or earlier for their patients who underwent surgeries. So this has been a fairly mature technology and has been used in medical use and other fields for a fairly long time. And this is the first functional level of AI in deployment in healthcare, which is chatbots, virtual assistants, AI systems that can answer questions, provide information, carry out basic interactions, including healthcare symptom checkers. Uh, at this level, what happens is that you can build virtual health assistants to triage patients and handle initial patient queries, deploy chatbots for customer service, appointment scheduling, patient education, and engagement, employ multilingual conversational agent for global access to information, and use conversational agents for responding to queries for customers. So it will augment human communication, reduce cost. Uh, what it does is actually augments clinician-patient interaction in handling from one to one to many patients. So for hospital administrators, this will also help organizations to expand their outreach beyond the stipulated office hours and ease the appointment scheduling and also assist patient educators and counselors in patient interactions, record keeping, documentation. So the beneficiaries are individual organizations and governments, any role which is about speaking, desk-based jobs, uh, they can be handled by this technology, fairly mature. Any job that does not involve high-end motor skill will be up for augmentation first and elimination later. But at this stage, I think we have already started eliminating the jobs which are front office and back office. So this has been they're fairly matured and technology deployed at scale. I believe every clinician stands to benefit, every hospital stands to benefit, every healthcare provider stands to benefit from the first level of AI. The second level of AI is the reasoning AI, AI that thinks. I gave it the name of thinkers. Uh, while the first level of AI systems address motor and communication functions, the second level moves beyond to cognition. The thinker level AI performs logical reasoning, contextual analysis, and clinical decision support. Neurosymbolic AI reasons through complex clinical data, identifies patterns, and provides evidence based recommendations. There are a lot of use cases in terms of what it augments and what it can do to human judgment. The timeline for this has been around 2023 to 2025. This second level of AI has found quite a good acceptance on clinical decision support system for diagnostics and treatment planning across specialties, aiding what I call medical decision making by clinicians, fraud detection in healthcare, chronic disease management, medical research and evidence synthesis, drug discovery, stimulating complex molecular interactions, optimization of organizational, technical, and human resources. In my view, this has huge impact on human judgment, and this will help in decision making in terms of differential diagnosis, treatment logic, and medical research evidence synthesis. It also helps in demand forecasting, predicting health outbreaks, optimizing inventory logic, primary care, adjusting treatment plans, and based on real-time data from wearables, and chronic disease management through digital therapeutics and related tools. Clinicians, decision makers will immensely benefit from this level of AI. And I think the biggest beneficiary would be the accuracy in primary care, early detection, diagnosis, clinical judgment, improvement in quality of interactions, and clinical outcomes. This takes us to the next level of AI, autonomous AI that acts. I gave it the name of doers. I was involved in 2025 to build this with one of the most celebrated digital health entrepreneurs of our time. And we implemented this, and I was pleasantly surprised to see the quality of interactions. It almost looked like clinician talking to a patient. You know, for me, this was something unexpected but positive. At this level of autonomous AI systems perform tasks without continuous human oversight, combining perception, reasoning, and decision making to execute complex healthcare functions independently, including robotic surgery. So the conversational AI communicates with reasoning AI. Equipped with all these capabilities, the AI now starts to act. My sense is that between last year and till 2027, this would have reached phenomenal scale in healthcare. The use cases of this are AI scribes, robotic surgery with minimal human intervention, autonomous management of routine follow-ups and care coordination, replacement of selected touch points across the continuum of care. Well, that's the reality uh, of where healthcare is headed. I would even go to the extent of saying that it may replace conventional electronic health records with intelligent patient portals that will go on beyond recording the line of treatment. This finally augments human execution and eventually will start replacing it too. That's the harsh reality. So will augment the clinical trials design, supply chain resilience planning, helping clinicians and healthcare leaders with foresight and logic. It will benefit organization and citizens. Of course, the biggest beneficiary in my sense will be clinicians' time and care outcomes. Patients, clinician organization will become efficient, will be able to get the right information on right time and drastically change the healthcare supply chains. This will reduce the clinicians' burnout, improve eye contact, and move healthcare from a black box to glass box, as I said. Very excited about this level, but one level that I'm most excited about is the level 4. And you can understand that as we have been moving up the level from talkers, thinkers, doers, and now innovators, which is AI that creates. So I gave it the name of creators. This level of AI has a very different role. As I said, none of us will be doing the things that we do today by 2030. I mean it. The timeline for this is 2027 to 2029 to be at scale. But this most transformative AI will move beyond execution to creation. These systems will be enabled by metacognitive functions. And I am very excited for one reason. When I founded the Academy of Digital Health Sciences, this was with the goal to address metacognition, which is thinking about thinking. These AI systems can generate new knowledge, new clinical pathways, new medical devices, new pharmaceuticals. And in my view, testing through blood samples would be a thing of the past, quite a possibility. Uh, and none of the conventional care delivery models would be the same when this gets in. Effectively, what this augments is phenomenal thing called imagination. So we started with human communication, moved to human judgment, human execution, human imagination. So far, we have been treating the phenotype. Now we will start treating the genotype. I'll also give you an example that we have the assembly line approach in medicine now. It works wonderfully for the pharmaceutical company. Anyone with a HbA1c of 7.2 or so on will get a typical glimepiride plus metformin. And now, of course, with newer treatments like semaglutide and others. But if two people do not even break the food in the same manner in the body, how will the same medications act on them? This level of AI will change that. I think I will not be wrong to say that 8 billion people can be treated in more than 8 billion ways, rather than the current form of 8 billion people being treated in one manner. In fact, the humanity at large will be benefited, but scientists, researchers, specialists, and senior management would be the biggest beneficiary. I think it will be the end of generalized treatment, as I would think. And this is where I believe we will be entering the golden age of medicine. So just imagine what you would be doing in this level of AI being implemented by 2029. The last level, organizational AI, AI that can run systems. While I give it the name of leaders because you can run an entire organization with AI. While I'm sitting today in Los Angeles and recording this lecture for you, but the four strategic business units of digital health associates ecosystem, the Academy of Digital Health Sciences, Health Parliament, International Patients Union, and Global Digital Health Summits are being run as an organization with AI. So I don't need to be there physically. And we are implementing this level of AI now, but my timeline for the healthcare and other systems is between 29 and 30. I think we will see the deployment at scale when entire organization can be run without continuous oversight. And this is, I would say, what I call institutional intelligence, coordinating across people, processes, and entire health ecosystem. Uh, this will be the age of hypercognition. And every individual in the system could have a hospital, not hospital, hospital. Most of the functions of hospitals will move forward to home with the people. Um, and hospitals will only be left to manage accident and emergency, and probably surgeries. That will happen at the innovating AI level once we get it. And I think the three-tiered healthcare system will go when this level of AI comes in and will be fully replaced by an integrated, seamless care delivery model, AI-driven hospital administration and resource allocation at institutional scale, predictive health policy planning at national and global levels. And I think this will augment human leadership. So if you are talking of AI governance, and if you understood these five levels, of course, each of them have layers within. And this is our job at Academy of Digital Health Sciences to prepare clinicians and healthcare leaders for 5 levels of AI and how to run practice and organizations in this age. Um, Founders, CEOs, C-suite leaders, clinician, KOLs, scientists, insurance companies, public health leaders, and policymakers will be augmented by this level of AI. I think society at scale will be the beneficiary. I, in fact, call it the golden age of medicine. This is what I announced at the last Global Digital Health Summit in September when I unveiled this model. Uh, we will move from healthcare to health, from disease management to sustained human flourishing, and from symptomatic treatment to preemptive care, from hospital to hospital, and from patient centric to health and human centric. I think we will bridge the gap between longevity and health, which is today a huge gap. And all of you will witness something which we are witnessing today in our organization. We have more digital team members than physical team members. I think almost all organizations will have digital team members, which will exceed human team members, and this will happen by 2030. Now, let me sum up this in one slide for you. So, what has happened over the years when AI is maturing? You have passive agents that work within a defined framework, they are deterministic. We will move towards active agents, which have learned the process, become intelligent, they are non deterministic. Generative AI has already moved to multimodal AI. Large language models have moved to large multimodal models, large reasoning models, and large action models now. Natural language processing, which used to be scribe, is moved to natural language programming. You actually don't need to know coding to do technology, to learn technology. This is what we exactly do through our courses. We had doctors with 50 years of medical practice when he joined our course. At the end of the course, he created his own tools and sent to his grandson in the US. And he had not learned the T of technology. He said, "Sir, I passed MBBS 50 years ago." So I think technology is simple as long as you're explained and taught in a very simple language. And that's our endeavor. And I'm glad NB, the National Board of Examination, has given us the opportunity to share this with you. So technologies will move from being deterministic to probabilistic. Technology will gradually replace tasks, then jobs, then people, and finally options that don't use technology. And that's why the message to you is start embracing technology and make it your force, not your fear. This is very interesting. When I analyzed last year, I think we would have come a few notches above. The AI of today was having an IQ of 155, Einstein at 160. My sense is in next 3 years, it could be 10x. So you could have an assistant with an IQ of 1600. Just imagine how powerful you would be if you understood the entire domain, how to leverage it. So if you thought this was like technology or economic change, sorry, it's not. I looked at history. Besides what I do, I am also a policymaker, so I track history. A large part of the first millennium and beyond, anyone who was strong in agriculture ran the world. They were strong economies. India had 1/4 of the world GDP, exactly as 27%. Things changed. Those who had firepower, they had the power. Military, US and UK, they ran the world. Now it is trade. That's why you're seeing trade wars, trying to contain trade, capture it. But we are headed towards technology. This is where the crux lies. But so you will think it is an economic or technology, and sorry, it is not. This is actually an intergenerational cultural societal change. Everyone has to change with society. So if you don't change as society changes, you get left behind out of the orbit. So we have to move with the society. If you thought I took you way back into history, let me bring you closer. 19th century industrial revolution replaced physical labor, and we are all mental labor. We don't do physical work. Technology revolution is replacing mental labor. So your competition is not your colleague, your competition is technology. So you'll have to master it. You don't have a choice. Again, I say this that in digital age, pride, ignorance, and arrogance have similar consequences. Of course, in our full lectures, I have 8 slides as an example of this. But in the interest of time, I'm going to cut it and just say that no matter how old your practice has been or how many thousand patients you have treated, it really doesn't matter. Our research shows that patients are actually preferring clinicians who understand digital tools, and any professional who is confined to a desk-based work will increasingly cede their roles to algorithm. I'm very optimistic of what technologies will do. Technology create opportunities and opportunity create jobs. So digital health will bring phenomenal opportunities, but it's not a birthright. Only if you master it. I say it is the great reset, the golden age of medicine. And I'm quite sure that you as clinicians, if you learn technology fully, you will be the leaders in the golden age of medicine. 2 years ago at the Global Digital Health Summit, I started with my keynote and I ended with my keynote with this message. This is not the age of competitors. This is the age of creators. If you create, you will enjoy. If you compete, someone will outdo you. And we have created resources for you to use. So if you want to get updated on artificial intelligence, you can look up artificialintelligencenews.org. It's a newsletter which drops on your mailbox the way you want it. Uh, you don't have to pay for it. Thankfully, BDR Pharma has sponsored this. So no ads, nothing. You get the information you need at the time you need in the format you need. It's free for you, but paid for by someone. Uh, this book, Digital Health Truly Transformation, still remains the most comprehensive book ever written on digital health. You can check every specialty and the future of what's in it. For those who are looking at the hospital of the future, pharma of the future, clinician of the future, from 20 to 21st November at New Delhi at the Global Summit. Health, you will witness live what the clinician of the future should look like, what the hospital of future should look like. And all that I have spoken today to you as a part of this lecture, uh, the functional AI pyramid is a 25-page uh, article that I have written detailing out what it means to you. You can download it free from the Help Parliament mobile app, which is available on Android and iOS. And though I couldn't join you live today, but I hope that I will get to meet you in person soon. And I thank once again the National Board of Examination for giving me this opportunity, and especially Dr. Suresh for accommodating my request to do it online. And I wish you all the very best. And I am sure that you, through your work, will lead not just medicine, but add glory to this wonderful, noble profession of medicine. Thank you so much.